Hello, everyone. It's so nice to see so many folks and across our different platforms. And I just want to thank you for all of the messages over the course of the past few weeks. I'm really glad these conversations have allowed you to get to know both some of the healthcare issues which Americans are facing, including New Yorkers, including those in NY-17, as well as what's at stake in this one big betrayal of a bill being put forward and led by a Republican Congress right now. It's also been a really wonderful to get to introduce you to so many of the very talented candidates who are running for the Democratic nomination in NY-17. And I hope these conversations continue to be useful to you and that you will individually engage with the candidates who are traveling across our district now and who will be probably everywhere across the rest of the summer. I'm so pleased to be able to invite and have a conversation with Effie Phillips-Staley today. We bring her on momentarily. Really appreciate her taking the time. As I mentioned last time, it's always so important, never more important than now, to really just know who your messenger is. This is also my shameless way to show you photos of my kids. I'm Kevin McAvey. It's really nice to meet you. I'm a husband, father of 3, and that's why you see probably every week these bags just seem to grow a little bit. I'm a Bedford resident, a lifelong New Yorker, educated at Colgate, Cornell, Georgetown, and really take personal affront to many of the attacks on our institutions of higher education right now. I'm also a state healthcare policy consultant for a nation-leading consultancy. And like many of you, starting in January or February this year, I really felt the imperative and the need to get off the sidelines and be a more active participant in our local politics. I've had the pleasure and opportunity of engaging with so many of you. The videos that have gone out over the past couple of months have generated over 150,000 views, which is just blows my mind because I don't know what I'm doing. But more than that, it's just been a tremendous way, I think, for us to engage about the issues on a fact-based foundation. But it's my turn too. I've been invited, and I want to thank the Bedford Democrats and so many of the Democratic organizations across Westchester for inviting me to go into the weeds next Wednesday, June 11th, from 7 to 8:30. If you want, the link should be circulating online. If you Google Into the Weeds and Kevin McAvey, you'll probably come up. But the hyperlink is down there. I'll be talking about the actual provisions and breaking down the provisions in the One Big Beautiful Bill. I'm talking about the ACA marketplace provisions and the Medicaid provisions, and how it doesn't just impact the individuals who are covered by these sources of healthcare, but will actually impact everyone in New York who depends upon a financially sustainable healthcare system. And everyone will be affected by the reforms being proposed by Republicans right now. So if you want to get weedy with me, 7 o'clock on Wednesday, June 11th. Also, if you see children, there he is, like running through the background, that's the state of life, and we're just going to roll with it. I don't know what they're doing, but I am 95% sure someone's watching them. The purpose of these conversations is to engage residents in NY-17 in our political process, equipping our community with information about the policy issues impacting our families, households, and businesses to help us identify the best person to represent our interests in Washington. We're going to be discussing the issues, fostering community, and introducing the candidates. And at the end of this presentation, I'll share who we're going to be talking with next week. Broadly, I wanted to raise your attention to 2 really interesting and important articles that came out this week. I'm going to touch upon them really briefly because, as my wife said when she was listening to last week's podcast or video stream or whatever this is, she's like, get to the candidates. So I want to get to our candidate. But the Brookings this week came out with a friend of mine, Kristen Link Young, wrote a really important article that speaks to, it breaks down the bill and its provisions in a really accessible way, and speaks to how the magnitude of this is very similar to what was previously proposed during the first Trump administration in 2017. And I just want to call out a few ways that this bill will weaken our health insurance marketplaces. I'm not even talking about Medicaid. We've talked about that before. We will talk about it again. But just to underline how much is in this bill and how destructive it is and how misleading many of the statements are, I wanted to call out a few of these provisions that Brookings highlights. The actual bill itself will weaken our health insurance marketplaces, creating new paperwork barriers, which will result in about 2.5 million additional Americans being required to submit new types of paperwork. It eliminates passive enrollment. So you're totally eligible, qualified, and instead of making it easier to kind of maintain your health insurance as if this is some luxury good, it eliminates that option. And offers consumers fewer and shorter windows to enroll to make it, again, harder to get access to healthcare. It cuts eligibility, and I'm not even talking about for undocumented immigrants, which have been who have been villainized by this administration, but for lawfully present immigrants, which states may seek to individually across the country, red and blue, for children and elderly, asylees, refugees, people with temporary protected status. The administration is seeking to cut eligibility for those individuals, as well as for individuals who are trying to resolve paperwork issues. So if you can't meet this higher bar of even more paperwork, and anyone who's ever sought to get access to healthcare through these pathways know it's not an easy affair already. You can't even kind of get temporary coverage during that period. And then finally, it results in higher net costs for everyone. The percent of income enrollees have to pay in premiums will go up. It allows plans to cover a smaller share of costs and makes financial changes that will increase premiums for all. The upshot of all of this, and again, just to take us back big picture on the latest estimates, and I'll be sharing some more over the course of this week. The latest estimates for the impact, combining these ACA marketplace impacts. So these are for low income, often working people, as well as the Medicaid losses, around 10.9 million individuals. And then including if the Congress allows the ACA enhancements to expire by the end of the year, 16 million people could lose health insurance in this country. Medicaid losses only in New York, we're talking at least 650,000 to 1.1 million, depending upon a number of assumptions, with like a midpoint around 800,000. That's not including the folks who will lose coverage from our essential plan. And I'll talk about that more next week. $1 trillion reduction in federal healthcare spending over 10 years. This is spending that goes to support a healthcare system which we all rely on. And the health systems will have two options. One, obviously, to the extent markets allow, seek to raise costs for everyone else or cut services. So when you talk about taking dollars out of our healthcare system, it will very much impact all of us. And then finally, Larry Levitt put out executive director of the Kaiser Family Foundation, put out an article this week, Make American Healthcare Affordable Again. Just a friendly reminder, we pay nearly twice as much as comparable countries around the world for our healthcare. And yet, and these numbers are so small, but all adults, a survey of all adults in 2023, near over 1 in 4 reported delaying and or going without healthcare due to cost. And then if you look at those individuals in this country who make below 200% of the federal poverty level, which is $13,590 for a person living on their own and $27,700 for a family of 4. Really pretty darn low. That rises to 40%, or 4 in 10 individuals of those classification. And while we are kind of fighting on the fringes to make sure folks with the least amount of assets and lowest incomes in our country have access to basic health care, healthcare access and affordability is a larger issue that confronts every American. And I just wish our policymakers focus on actually solving problems as opposed to focusing on some of these, how we can make life even harder for those with the least. But I think that's been the story of Effie. And I'm so wonderfully pleased to be able to have Effie on today. Effie Guadalupe Phillips-Staley is a nonprofit executive with a decades-long work in history and education, culture, and social justice. She's serving her second term as trustee in the Village of Tarrytown, where she prioritizes creating safe and walkable streets, building more affordable housing, boosting climate change resilience, and supporting local businesses. Effie grew up in a middle-class family in Sacramento, California. Her mother immigrated to the United States from El Salvador. Her father was a war veteran who served the U.S. Army in World War II and the Air Force during the Korean War. Today, Effie lives in Tarrytown with her husband and her 2 children, and I couldn't be more pleased to hear about her journey to New York, to Tarrytown, all that she's doing, and all that she hopes to do as potentially our next Congresswoman. So Effie, it's so nice to see you.
Kevin, I'm really grateful for this invitation, and I'm especially grateful for the way you started this conversation with the data that really reflects sort of the horrific impact of the big, beautiful bill on so many lives. It's not just about the lives of people, which it is about the potential of our nation. We're a nation of people. Our potential can only really be met if we are healthy, right? And so it is appalling. I just have to, as I heard you read through sort of the dire statistics, to think that the health of our nation is being sacrificed to put more money in the pockets of the 10% of our nation that already is well resourced. It makes little sense on every dimension. So thank you for being very clear about those numbers.
Of course. I mean, it's a bigger concern. I want to talk about your journey, and we're getting into it already.
Every step I had to respond to.
No. I mean, I fear that we're losing our moral compass in so many of these conversations, and in so much of the legislation that's being put forward. And I see this bill, and I think this is, again, like, goes to the story of your career and activism, where sometimes we lose ourselves. But I'm also optimistic that with the right people raising the issues and reminding us of, like, who we are, we can find our way back. And I mean, like, can you talk to me? I mean, can you talk to me a little bit about your journey? Because I think you've helped us find our way back on several occasions.
Oh, that's really kind. My journey, well, I've been a nonprofit worker, I suppose, in maybe the last decade or so, an executive for over 30 years, and I decided early in life, in fact, when I was in college, that I came from a working class family that could live as the middle class. But of course, I would be working. And so what would the nature of my work be? And I knew it had to be people-centered, that had to be in service of making the world a better place. Like, we have one shot, right? on this globe. So we might as well use it. And this is my feeling, to make our lives better and to make other people's lives better. And so that's what I did. And so, but that sense of service really came from my family. As you mentioned, my dad, a veteran, a guy who was really working class with only a high school education. But he he could provide for us, and to live a really nice life, bought a 4-bedroom house thanks to support from the Department of Defense and the VA, because they had programs to support that. Was able to work as a pressman at the U.S. Mint, making nickels, like literally what he did. And we could go to great public schools. I could go to an excellent public university that I had to pay for myself, but it wasn't so hard because it was only $2,400 a year was the tuition at that point. So my mom always, worked in public schools with migrant children, helping them learn English as she learned English when she came to this country. So both a combination of their service sort of made me who I am in terms of my value set, but also the world was easier in the sense that working class families could really achieve in a way that I don't think they can now. When you look at the kind of cuts that happen, that are happening because Medicare is a key one. But the cuts across government, if my father were working in the Doge age, and lost his job, we would be in deep trouble. And that is something that concerns me immensely in this moment, that working people cannot thrive the way they used to. But anyway, that's just a little bit about my background.
Yeah. Well, I mean, I think you're raising just such an essential point. I mean, I think that most Americans would agree that we're a country where we want to make sure that everyone has access to the basic building blocks. And then from that, you can kind of, with enough grit and tenacity, you can work your way to almost any position in any state in this country. It's, but those building blocks are even starting to get harder to access, whether it's quality education, whether it's affordable housing, whether it's access to healthcare. It's just it's all becoming harder.
Right.
But before we get into like some more of the policy, when did you come to New York, and can you talk to me a little bit about your work in Tarrytown?
Sure. I first moved to New York in 1999.
Yeah.
I came because my background is in the arts and social justice, and when I'm lucky, they're combined. But I came to New York because I always dreamed of seeing the Museum of Modern Art. To be honest, and so I did, and I came and I stayed for a week, and then I came back and decided I'd stay for just a summer. But then I stayed forever. New York is a beacon to the world for so many reasons, and a beacon to other Americans, like it is America's state. It is America's city, New York City. So I met my husband, had my 2 kids, and here we are.
Yeah.
But in terms of my time in Tarrytown, we moved to, first we lived in Dutchess County for a while. And then we came to Tarrytown in 2016, because to me, Tarrytown was sort of the model American village, a village or town, but village.
Yeah.
Walkable, great Main Street, built by generations and generations of working class immigrants. Diverse like America is diverse. And so in this respect, it was really a perfect place to raise children, I felt.
Yeah.
But at the same time, I'll say we were able to move to Tarrytown in a moment where we could afford to.
Yeah.
If we had to move to Tarrytown now, that would not be possible.
No.
So I'm grateful that we came in in this window, but I'm deeply concerned that affordability is, we all know housing is a crisis, but it truly is even in Tarrytown. But that's what brought me here.
Yeah, and you're this is again your second term on the village board.
That's right.
And what was there a particular moment where you're just like, I think I might have to run for Congress.
Yes, there was a very clear moment.
Uh-huh.
Well, just quickly, I ran for local office because I was approached,
Uh-huh.
like many women, I've been used to working in the background politically. Never occurred to me to be able to run.
Mm-hmm.
I was approached and I thought, yeah, no, we need to step up. So I'll step up, and I ran. But in the case of the run for Congress, when Trump won last time, uh, I knew that being an elected official had even more weight. It was critical that we protect our communities, that we think about how to navigate this time that we're in. The first administration was problematic. Obviously, this one has been catastrophic. And so, in terms of my run for Congress, I'm a member of the Executive Committee of Hispanic Democrats of Westchester.
Mm-hmm.
I went to the founder and said, what can I do as an elected official to really ensure that people are safe, that their needs are met? Like, what should the focus be moving forward? We're already focusing on housing and many things. And I was expecting guidance in terms of my local office, and she said, run for Congress. And I was like, what? Right? That wasn't exactly what I thought you were going to say.
Yeah.
But I believe pretty strongly that when asked to step up, to be representative of communities, and in this case, I believe the communities that I represent strongly, not just all of NY-17 who wants to see a just, sort of fair society, but Hispanic communities, working class communities, unions. I come from a union family, and I've been in unions myself. And so because I was asked to step up, I felt that this was essential.
Yeah.
That I would be ashamed if I didn't.
And it sounds like there was an encouragement for you to be a representative of issues that are really important, not only to all Americans, but also particularly important right now to certain communities. What are those issues?
I would say right now, we see broadly, in a way that affects the entire nation, our institutions being dismantled or really being weakened.
Like what?
And the way in which it's happening in many ways. But when we look at immigrant communities are being vilified in a way that is enabling this administration to not only, profile, abuse, mistreat people who are not criminals, right? But it simultaneously undermines our judicial system. It simultaneously undermines our rule of law. I mean, when you see a president resist a Supreme Court order for a person who was mistakenly sent to El Salvador, right? Or not mistakenly. I mean, that doesn't just impact one person or a few people. It takes a sledgehammer to the foundation of the nation that we've been building for 250 years.
Yeah.
These systems only sustain themselves if we sustain them. And so this, to me, is it's like a double-edged assault against vulnerable people and against the systems that protect us. So this is what I'm thinking about very clearly, which is why it's important to talk about immigration. It's why it's important to talk about reproductive justice. Yet another example.
And that's really interesting. And Effie, just to call out, the immigration issue is just pervasive, and I just can't believe when you kind of look at the news every day, it's something like inevitably on the front page, you're going to see something from some part of the administration attacking folks who often aren't even undocumented immigrants here, like who are just immigrants here. And when you kind of, I bet at folks who are viewing this at home, I would argue that most of our forebears, like not too many generations before us, were all immigrants. We are a nation of immigrants.
Agreed. Most of us are here not only as immigrants, but immigrants who have escaped cycles of violence,
Hmm.
because this nation is a beacon for opportunity.
Hmm.
This nation is a beacon for prosperity. We can move up the economic ladder here if the systems that enable it are just and
Yes,
open. And it's not just for the benefit of an individual person. It is fundamentally for the benefit of a nation. And you can see why we're a powerful nation, because of
absolutely.
all the innovation that
Yeah,
emerges from the people that make it. Are we perfect? No. Are we moving towards it? Constantly, as long as we are accepting of each other and the reality of what made us great,
yep,
which is immigration.
yeah.
So
And I think that we need a system in place that ensures that there is a pathway for folks to come here that is accessible, that's easy, and that allows for us to continue bringing the best and brightest, and those who are willing to work to get to everything that America offers.
yes, seeking
And
asylum is part of our national history,
it
and
absolutely is.
it's
And
part of who we are.
And you also mentioned reproductive health. Like,
Mhm.
I don't know about you, but I'm so surprised at how that's not a front and center issue right now. I mean, it might be overcrowded by so many other provisions in the bill, but the bill actually cuts funding for Planned Parenthood writ large, and I do see just a continual attack on reproductive freedoms in this country.
It is an issue that I talk about frequently, in spite of the fact that there is a perception that it doesn't poll well.
Hmm.
To me, uh, my platforms are not built on polling. They're built on need,
Yeah.
and the decades of work that people who've been opposed to women's reproductive freedom have put in to get us to this place has tragically been effective. I mean, it is stunning to me that Trump could, A, that we are where we are, but B, that President Trump could, uh, you know, do away with the Biden era declaration that doctors should be able to safely provide emergency abortions to women who need it. If somebody needs an emergency abortion, that is a gravely serious situation. That is a
Mhm.
life or death situation. The thought that it's acceptable to take away that protection is really it's somebody who's okay with people dying.
Mhm.
And it's not just women dying,
Mhm.
or um, women are breadwinners in households.
Uh-huh.
Like,
Yeah.
the impact spreads economically
Mhm.
to other children,
Mhm.
to communities.
Mhm.
Um, it undermines a person's ability to thrive, which goes back to the same thing. It undermines our nation's capacity to thrive. This
Yeah.
is not sensible policy. It is, I don't even know how to describe it. It's so insane to me.
Yeah.
To what, I'm sorry, I could go on, but
No,
I'll
I know. I know. And like
rein it
these are all issues that I do feel like we continue to like lose our way on, and lose our, as you were kind of mentioning, ability to communicate about and bring people along. Because if you do, I think, rationally explain what's at stake here, I do think that most Americans can agree about a different way forward.
I
But like,
agree.
as you're moving across the district and visiting households and going to events, what other issues do you keep hearing that come up and are concerned for at the kitchen table across NY-17?
Clearly, and I'm sure all the other candidates are saying the same thing, and it is fundamentally, it is affordability. And it is something that I see very clearly in many ways. I see it, and I've seen it for years as a trustee. Um, Housing affordability. The kids, my kids, when they have lunch at school, have their friends at their tables. One by one, they start to disappear. And it's because their parents can't afford, you have to pay the rent.
Hmm.
They can't afford to buy housing. And then they have to make these terrible choices.
Yeah.
Leave the community that
Mhm.
they love, or to find something that hopefully is more affordable, or stay and have a larger percentage of your income go to housings, in many cases over 50%, and
Mhm.
that cuts into your capacity for other essential things like
Yeah.
food, like groceries,
Yeah.
right? So it's so you see the impact of this on individual families, but also on communities. I canvass, and as an elected official, I go to door in my neighborhood and have for years.
Mhm.
So I know who lives where. And the turnover is staggering. It's as if a mass migration of people moving in different directions, trying to achieve affordability, is happening, is playing out before us now. So that is getting that under control, um, is critical. Um, and then, of course, there's an immense amount of fear about what we were just talking about,
Mhm.
the undermining of our nation's institutions and every level. And I'm also seeing people laid off because of the canceling of government contracts.
Mhm.
That is spreading at such a rate.
Yeah.
The degree of chaos that creates in people's lives. People, I don't understand how they fail to think that all of this random Doge cutting, again, for the purpose of more funds, tax cuts for the rich,
Mhm.
actually destroy people's ability to pay their rent.
Yes. Yeah.
So I'm seeing a lot more people unemployed, specifically for that reasons, and
Yeah.
a lot of institutions, or rather, social service institutions, losing essential funding to help people, um, goodness, around safety issues,
Mhm.
domestic abuse, um, funding the police, extra training for the police to be able to handle situations like that.
Yeah.
So yeah,
I mean,
it's not pretty out there.
it isn't, and it all seems so reckless. There is one thing, if your new administration comes in and like past administrations have done, and really thought like the size of these programs, we're spending too much. We do need to get our fiscal house in order nationally. I think that most Americans would agree we cannot keep this level of deficit spending going on.
Right.
But this wasn't a rational kind of strategic decision. These were individuals making these decisions who had very little familiarity with the programs. And I don't think that we have fully felt, as you're indicating, like the impact of losing this capacity in our federal government. And then you think about the trickle down capacity and research and science and the cuts that are being put forward here. It's going to have long-term ramifications and affect our standing around.
Mhm. Yeah, no, it's madness, and I think anyone with a true business sense
Yeah.
uh, would have thought carefully about the kinds of costs that are going to grow, given the random cut. I mean, how much did FEMA cut? A third of its workforce,
Yes. Yeah.
and Trump is now suggesting that FEMA be done away with in a moment of increasing climate um, uh, insecurity.
Yeah.
Uh, it is, and what is the economic cost of that? If they don't want to think about people, if they think people don't matter, at least think about the economic cost of these actions. And yeah, it's really something.
I couldn't agree more. And that actually brings me to something I wanted to touch on, which is last week might have been you released an op-ed in Low HUD. Voters want courage from New York Democrats, not watered down conservatism. So like as folks are starting to get to know the different candidates who are running for office, like what is the path that you want to blaze that's different than some of the others, and really what do you want to see from us as a party?
My feeling or my belief is that there is a perception that the only way to win in New York 17 is to move to the right. And this is why I sense not a lot of this is why I emphasize things like immigration, things
Mhm.
like reproductive justice,
Mhm.
because I don't believe that we need to abandon critical issues like this because we're
Mhm.
concerned that people may think, oh, that's too much, that didn't poll well, that's too much, we need
Yeah.
to focus on. Um, that is, I think this is not the time to be cautious. I think we have enough evidence of extraordinary cruelty, enough evidence of fiscal mismanagement, enough evidence of a government that is not advancing the public good. I mean, for me, it's incredibly clear now what government should be doing.
Mhm.
Government in this moment is not people-centered.
Mhm.
Government in this moment is in the service of a small number of people and making them more wealthy, right? Government must return to being people-centered, not for handouts,
Yeah.
not to give people things, but to ensure that our systems are fair so that all of us can achieve our best potential. That is the least we can give people in our nation, allowing people staying healthy, right? So we can achieve our best potential. Ensuring that food is affordable, that housing is affordable, so we can achieve our best potential, right? And so it, to me, is critical to really focus on issues that would often be framed as progressive,
Mhm.
right? But
Absolutely.
progressive seems to be kind of a bad word right now, in part because um, we're letting the Republicans dictate the terms,
Mhm.
right? Right. If we focus on climate justice, or if we focus on health justice, if we focus on equality, if we focus on fair immigration, um, you know, we make things better for everyone.
Yeah.
Um, I'd like to see Democrats really double down on that.
And there are a few things, and I'm glad you raised it, that are more that affect us more personally, and that's a concern that's there are a few concerns that are more pervasive than access to a doctor when you're sick. Healthcare. What are you hearing, and what do you see as the better path forward than what's presently being proposed?
Well, what's appalling to me with the big beautiful bill um, is that for New York State in particular, is that you, I think 15% of our GDP is healthcare, if we're talking about money. You can't cut billions of dollars of federal tax credits from our budget without hurting the entire state across the board. Fundamentally, that is too large. Um, that is not something that we can make up very easily as a state. We need our federal partnerships to enable healthcare in this way. The question was, what am I hearing? I'm sorry, is
Yeah.
that what you?
What are you hearing, and what do you see as an alternative path forward?
What I'm hearing, many things. We have, for example, deserts where there's the absence of healthcare,
Mhm.
absence of OBGYN care,
Mhm.
not just in large pockets of the state of New York, but across the nation in general. Um, with the big beautiful bill, those are in even more danger. So we are going backwards in terms of providing the kind of care that we need to thrive as individuals and as a nation. And we just fundamentally have to reverse that,
Yes.
not just for the economy of the state, um, not just for people who may be lower income and have difficult access, but when you take that much money that would be going to health centers, that would be going to hospitals through insurance programs, you're undermining their ability to serve everyone. I
Yeah.
believe, as you said in the beginning. So yeah, no, this is a crisis. This is an unimaginable crisis, and Lawler knows it. It's baffling to me that he would be the vote that allows this kind of carnage to hit our state. with I mean, particularly with someone who has aspirations to be governor.
Yes.
You know, is this really what he wants to enable? The loss of what, $13 billion in tax credits that actually support people's health?
Mhm.
The only answer is that he has no autonomy and he just
Mhm.
does what he's told. Is this
Mhm.
the kind of person that we want
Yep.
taking care of us? And I mean, I think the answer is clear that he is not.
I would very much agree. And the Community Healthcare Association of New York State came out in strong opposition to the One Big Beautiful Bill, noting that it would cost hundreds of thousands, if not over 1 million, individuals across New York State access to their healthcare system. And as you note, and as I've done work across the country, when you cut Medicaid, when you cut our healthcare programs, it has tremendous indirect impacts on many aspects of everyone's lives. As I noted at the top, it's not just taking away access to a doctor for people, which I just think is so strange that in America, the wealthiest nation in the world, that is viewed as some sort of a luxury good or privilege. But those are dollars that are no longer going to a healthcare system, which all of us depend upon. Maternity care is particularly vulnerable, particularly in many rural areas or where the hospitals have high dependency on Medicaid populations. And then, as you mentioned, it affects our economy. So many individuals, directly or indirectly, are employed through healthcare, and those are individuals that may no longer have jobs. So I think that our healthcare system certainly needs reform, as Larry Levitt reminds us of all the time, among others. But I would hope we do so really thoughtfully and with consideration of the downstream impacts. I think that Effie so well said.
I appreciate again. We are again. I keep going back to the same thing. We undermine the potential of our nation.
Yeah.
Fundamentally undermine our ability to thrive and our ability to prosper. And Mike Lawler knows these numbers. He knows them. This alone disqualifies him. We have one job as elected officials, and we have many versions of a job, but like it is to look out for our constituents and for our well-being. And then, of course, within Congress, it's to be a check and balance, right?
Absolutely is. I mean, the co-equal branches of government, right? Where is that check going on right now?
Somebody, what we want is a fighter who knows that they're equal within this branch of government, and to look back at the executive branch at this moment and say, absolutely not, you're hurting our people, you're hurting our economy, right? You're hurting, again, the potential of our nation. We will not allow it. He knew what was everything you just described. Mike Lawler is an intelligent man. He knows the metrics. He knows the impacts. This is how he voted. And
so are you our next fighter?
I have been, yes. And I always have been. I don't know how else to say that. It's like, there's only one answer to that question. But no, I mean, like, I grew up with a powerful sense of justice, right? Mm-hmm. It's why I, have always been politically active. It was why I was a clinic escort when Operation Rescue was attacking abortion clinics and women's trying to get into them. I can't stand by and allow this to happen to people. Our lives, our children, our homes. Like I said earlier, we've got one shot, to my knowledge, on this earth. And if we don't create good, who will? Creating good in the world, it doesn't just happen. We actually have to do it. And this administration and our representative, they simply are not.
And I appreciate you doing double time work on behalf of all of us and heeding the call from many of the folks in our community to step up and run. It's no easy commitment. It's incredibly time consuming. And it's because you want to help us all get to a better place.
I appreciate that. To be honest, like I said, when I was first approached by Hispanic Dems, I don't see an alternative in this moment. I would be ashamed if I didn't. This is the moment for all of us to speak up. And to be honest, which is, it is a crowded primary, but that is a good thing. I believe it's a good thing. It is an opportunity for many voices to speak up about what needs to happen now in terms of flipping the House and the future of our nation. So, and I'm proud to be part of this cohort of people who are trying to do that.
Yeah, I couldn't agree more. I think that a large, robust conversation is exactly what is needed in our party right now to bring new voices, new perspectives, new groups, engage new individuals who have been sitting on the sidelines and bring them in under a bigger tent. I strongly encourage all of our parties, and this is a statement from me alone, not Effie. I strongly encourage all of our Democratic parties across our counties to ensure that we have and hear from as many individuals who want to throw their hats in the ring for as long as possible until we determine a nominee. I don't want to preempt that process. And Effie, I really appreciate you jumping in and sharing your perspective and your values and what you see as a better path forward. If people are interested in getting involved and learning more about you, like how can they meet you and how can they get involved?
Well, definitely go to my Instagram at Effie for Congress. Go to the website. It's all Effie for Congress. We also have a podcast that we're doing.
Yeah, tell me about that.
Sure. We talk about a healthcare deserts. Unfortunately, in New York 17, we sort of have a news desert. Like, a few of the candidates got New York Times articles, which has some visibility, but we really need to find many different ways to get the word out. So started a podcast, Effie for Congress. You can find the link on the website, and where we talk about a lot of different subjects that are critical to the district. It's our way of creating our own megaphone. And so we've had 2 so far. They're posted on the website. Our next one, we're going to be speaking with members of the Haitian community about the recent travel bans and how that impacts our local communities. Of course, Haitians are an important part of our community, in addition to Cubans and others who are being prevented from entering the country. Again, we've always been a nation that offers asylum to people from places that experience systemic violence, and Trump just shut that down. So we're going to get into the details of the impact of that on the podcast, Effie for Congress.
Effie for Congress, and we dropped the podcast on Apple, a link to it in the chat. I think you can also go to Effie for Congress and find out other venues and ways to stay in touch. Effie, thank you for joining today and for running and for sharing your story and showing us a better way forward.
Thank you. Thanks, Kevin, for what you're doing and your time and your essential work in healthcare. It's much appreciated.
Of course. So everyone, again, it is my pleasure to be able to speak to some of the candidates on our behalf. If you have additional questions, I appreciate those that have come in. See, we are using them. So thank you very much. And if you want to get in touch with Effie, effieforcongress.com. Next week, I'm so excited to have my friend Jessica Reinman on next Saturday, June 14th at 10 a.m. So an hour earlier. We'll get started on the day with Jessica as we get to hear from each of the candidates and their priorities and how they see a better way forward for us across the country, including in NY-17. Thank you all for joining. The response to the webinars have been great, and I look forward to continuing the conversation. Talk soon, everybody.